Okay, a 25-year-old fell out of a tree.
Okay, I used to have those shoes and they're great. Okay, a 25-year-old who fell out of a tree. Okay, so I have my PPE on. The scene looks safe. It looks like I only have one patient. I'm going to consider additional resources. I don't think I need them at this time. My MOI is I have a 25-year-old who fell out of a tree. Was it a boy or a girl?
A male.
A male, of course. Okay. And I'm going to have my partner hold C-spine. Okay. Hi, are you okay? Do I get no response? Okay, I'm going to go for a painful response. Do I get anything?
No.
Okay, if I have somebody who's completely unresponsive, I'm going to go for a carotid pulse. Do I feel one?
Yes.
Okay, so my patient is unresponsive on the APU scale. The chief complaint is that they're unresponsive, and my general impression is poor because he's unresponsive. So I'm going to go through my ABCs. The airway, I'm going to check it. I'm going to see, do I see breathing? I'm going to answer for you since you're unresponsive. So if I'm wrong, tell me. So I'm going to say I see breathing because they're breathing. So I'm going to check a respiratory rate. So we'll count here. We'll say I get 28 in shallow. So I'm going to have my partner apply 15 liters per minute of oxygen with a non-rebreather. And we'll check and see if they're starting to get better circulation to see if that's helping. I'm also going to go ahead and open the mouth and see if I see any bleeding or anything. Since they have fallen from a tree, I don't see anything. So we will move on to circulation. So I'm going to check a pulse. We'll say I get 120. So we have a pulse of 120, so the patient's in shock. So I'm going to cover him with a blanket to keep him warm. I'm going to check skin condition. We'll say it's cool and clammy. And I'm going to look for any major bleeding. I'll ask my patient, do I see any major bleeding?
Leg.
Leg, okay. So I'm going to go jump straight to the leg because it's major bleeding. I'm going to have my partner apply direct pressure. Did that stop the bleeding?
Yes.
Okay, the bleeding is stopped. We're going to keep that direct pressure on and continue with our assessment. At this point, this is a priority patient. I do intend to transport, but I have to finish my rapid assessment first. So now I'm going to go into my rapid assessment, starting with the head. So I'm going to inspect the scalp. I'm looking behind the ears for possible battle sign, which we'll learn about later. I don't see anything. Okay, I'm going to push on the forehead. I'm going to push on the nose. I'm going to look inside the nose. I'm going to open the eyes and see if the pupils respond to light. They should constrict. I'm going to push on the cheekbones, the maxilla, push on the mandible. I've already looked in the mouth, but I'm going to inspect again. Okay, everything seems okay with the face and the head. So now I'm to the neck. I'm going to do 4 things. I'm going to palpate the C-spine. I don't feel any crepitus. I'm going to check for tracheal deviation and jugular vein distension. We'll say I don't see them, so I'm going to apply a C-collar at this point. Now I'm going to move down to the chest, pushing on the clavicles. Okay, palpating down the middle of the chest, feeling for crepitus, feeling the rib cage. That's one thing people forget of the chest a lot of times. The abdomen, I'm going to palpate all 4 quadrants in a rocking motion. 1, 2, 3, 4, feeling for distension. Since my patient's unresponsive, I can't ask them about pelvic pain, so I'm going to continue with pushing in and down. Feels stable, so I'm going to move down the legs. This is where the blood was, so I'm going to expose it. I see that there's maybe some bone sticking out. So in addition to the bleeding control, I'm going to have my partner apply a splint. Come on down. Since my patient's unresponsive, I cannot check motor or sensory, but I will check circulation by feeling for a pulse. We'll say I have a pulse. Come down this leg. Feeling all the way around very aggressively for any movement. I feel some destabilization here, or something that's unstable, so I'm going to expose it. What do I see? My examiner will tell me I probably see a deformity, so I'm going to have my partner apply a splint. I'm going to check CSMs in this foot. I can only check circulation. We'll say I have a pulse. Moving up to the upper extremities. I've already checked the collarbone, clavicle area, so I'm going to come down the arms. Careful not to hurt her actual injuries. Again, I can only check circulation. She has a pulse in that arm. Coming over to this arm. We'll say I feel a deformity. I'm going to expose it. I see a deformity. I'm going to have my partner apply splint. Coming down this arm, checking for circulation. Okay, at this point, I'm going to have my partner help me log roll my patient onto a backboard. On 3, 1, 2, 3. And I'm going to palpate the entire spine all the way down to where it probably feels a little uncomfortable for the patient. Okay, I don't see any bleeding. I'm going to put my patient onto a backboard now. We're going on a backboard on 3, 1, 2, 3. We're on a backboard. Now we are magically in the ambulance. Much later this time. I have 5 things left to do. I'm going to get a sample history. I don't have to ask the questions. I've already been tested on that in medical, so I'm going to get a sample. I'm going to get a full set of vitals. Earlier, I already got a respiratory rate and a heart rate, so I'm going to check a blood pressure. We'll say I get 110/70 because they're in shock. I'm going to check an oxygen saturation. We'll say it's 96 because she's on oxygen, or he's on oxygen now. We will check a blood glucose level. We'll say it's normal, 100. So we got sample, vitals. I'm going to auscultate the lungs, see if I hear anything unusual. Consider checking genitalia. I don't see any bleeding at this time, so I don't think I need it. And I'm going to repeat my vitals every 5 minutes on the way to the hospital. That's the whole thing.